This is WEJF 90.3 FM in Palm Bay. And of course, every Wednesday, it's Joe Steckler helping seniors of Brevard. And right now with Joe and our distinguished guest it's time for Joe Steckler and helping seniors of Brevard. Joe?
Right, thank you, John. Can you hear me all right?
We've got you loud and clear.
Yeah. The reason I ask that question, folks, is because in 2011, I decided that we needed another instrument in Brevard County to help seniors. And the events of the last couple of months have just really helped me really believe that the importance of information, education, and being able to connect seniors to resources that they need. And during the show today, we've got Dr. Lee Sheldon on. Dr. Sheldon's a periodontist, but he's more than that. He's a guy that's involved in charity work. He travels and he's brought new technology here to Brevard County. And the other guy is Kerry, Fink. Kerry's been on radio. He's TV work. He has a TV company now. But more importantly, all of us, I think at some point in our careers, realized that people really need to be educated. And I think Dr. Sheldon can talk about the importance of people being educated on good dental policies. Dr. Fink could talk about Dr. Fink could talk about the church. He could talk about God. He could talk about marketing. He could talk about radio work. And heavens to Betsy, I've had a lifelong career of being in the military, the radio. And yesterday, folks, I had a call from my daughter, and she was telling me, she said, Dad, she said, I do 30 to 40 of these Skype phone calls a week with my business, and we're not on Skype today, folks. So we're just doing a radio show, but one day we'll have it on Skype. There's a lot that can be done, and that's the purpose of this thing here today. So actually, we've got a couple of moderators. Kerry Fink is a really good moderator for radio and TV. I've been doing it for a long time, and the guy running the control panel is John Harper, and he's been in radio a long time too. But I want to emphasize today, Kerry and Lee, the importance of information, the right kind of information, and the importance of understanding what we're told when it can really help us about this business of social distancing and grouping of people. And this country has to understand that right now we've got a major problem, and I'd like for Dr. Sheldon and Dr. Fink to talk a little bit about this, and maybe bring a new light into why people need to tell people there are radio shows like this one that do a lot to help people, because there's never been a need for our people to have the best information possible that can help get them through a crisis. And I'll let you go with that, Kerry, and then we'll bring Dr. Sheldon in and see what Lee has to say. Okay?
One of the things that I've really noticed, particularly ever since you started helping seniors of Brevard in 2011, was that you had always, even in your days before when you had founded and established the Brevard Alzheimer's Foundation and created the Joe's Clubs, you had already started this path. You and John Harper had worked together on radio going back some 20 plus years, because you understood that in this county that's 70 miles long, north to south, you have to use media to get information out to out wherever they live in the county, north, central, or south. And when you started helping seniors, you said that was one of the objectives. You wanted to keep that information program going because it was so vital to get information in the hands of seniors. And who would have imagined at that point that we're sitting in basically April of 2020 when everybody is told let's do this the right way. Let's be safe. Let's stay home. Well, thank God that we have the ability to use radio, television, online, and we have all these tools so that we can get information in the hands of people. And so to sort of answer the call of what's going on right now, Joe, as you know, we started Helping Seniors Updates, which is a way to use the social media tool so that we can keep information going out on a 3 times a week, not daily, but 3 times a week basis, so that people can kind of get a sense of who's open for business, what services are available, what can happen. And that's really the point I wanted to ask you, Dr. Sheldon. We were talking before we got on the air. You were talking about actually being in the office and having to take care of an emergency dental situation because life goes on.
Life does go on. It's, we don't consider ourselves to be an emergency practice, but I've got to tell you, when you have to be in a position where dentistry that's supposed to be done is now being put off, well, things happen, And besides that, there are a number of people who have, neglected dentistry for some time, and then all of a sudden, in an inopportune moment, and I guess many people know, but to get everybody up to date, we are not allowed to do elective dentistry until after May 8th, and my guess is that's going to change to June sometime, maybe even July. So dentists can only do emergency procedures, and even the emergency procedures are spelled out as far as pain and swelling and infection. That's what we can treat. So it throws an entire different light on a practice. What's interesting for us is we have a board-certified surgeon. We have an advanced trained general dentist. And so we can do all that stuff. We don't do it ordinarily, but when pressed into service, that's what we're doing. And that's what we're doing. And yesterday, we were pretty busy. Hopefully we won't be busy because nobody wants to have to see a dentist for an emergency, but things just happen that way. And we had work to do. People lose fillings, people break teeth, people get abscesses, people get all sorts of things like that. With regard to how we're treating, I'm taking the question a little bit aside because we're not talking about information anymore. We're talking about radio and things like that. We're actually talking about what's going on. People need to be able to communicate with us. One of the primary things we needed to do for communication was to call every patient who was scheduled in March and April and say, well, we're going to have to put things off till May. And the other thing we're doing, and I'm doing it right now, is writing letters to our patients saying, hi, how are you? We're going to be here and we're here for you during an emergency. And if you need us, just give us a call. I've used Constant Contact. I've used YouTube videos in order to be able to stay in contact with patients. The last thing people want to be is in an information vacuum, because when there's an information vacuum, well, you just put in whatever you think rather than what you're hearing. It's probably why the president is doing his task force reports nearly every day. But yeah, it is information. It is continuous contact. You can't believe what a patient says when I answer the phone or when I'm calling the patient back, not one of our staff members. It means a lot. And so it's not just the communication. It's probably the quality of the communication. It's probably the originator or the recipient of the communication that can make a big, big difference.
Well, Lee, let me ask you a question. In your practice of your dentistry, and I know that you take a lot, you're very concerned about your patients. Do you have emails on all your patients that have email?
Yes, everyone is willing to share emails. Yes, I've got emails of every one of my patients, yes.
So with the technology we have today, you could, like with your newsletter, could you or do you send that out email to all the people that are on your list?
Yes.
Okay, see, that's a smart thing, and that's what we're needed to talk about today, because, I look at our paper for today, and there's very little information in there, but sometimes there's an information piece in there that it even triggers me to realize there's more that needs to be done for seniors, and that's the purpose. Like our show is called Helping Seniors. And I've talked on radio and I've talked on TV, and then my writings about the Sadowski Fund, and it's supposed to be used for affordable housing. Well, this year, the state legislators, for the first time, they say in a decade, it's first time in 2 decades, that they've decided to use the Sadowski funds for the purpose they're supposed to be used for. And they keep increasing the size of the budget and say, well, we need this money for that or this for that. But now, here we have the coronavirus problem, and they've got problems with getting checks to people. They got problems with the unemployment. So now they're thinking about maybe taking what they were going to use the Sadowski Fund for and letting it be used for something different. I would question about the $900 million they're going to decide to raise the state employees. If we got a problem with our people across the country, and with what this coronavirus has done to our financial markets, it has hurt a lot of people that were invested in 401ks, and they really had planned wisely on how to use their money. I'm going to call Dr. Fine, Randy Fine, who is our representative. I'm going to call him, folks. I'm going to find out how the legislators decided they were going to allocate those $340 million to building affordable housing, because Brevard County is about the 6th largest county in the whole state of Florida in terms of number of people over the age of 65. But what really got me, and why we can talk about it on this radio show, is that they talk about using these affordable housing funds for building state fund houses. That's not what it's to be used for. And sometimes inadvertently a reporter makes a comment about something, and you get somebody like me that's been following this for years, Lee and Kerry. I see a disconnect, and I think that those are the types of things that need to be brought out on radio shows, and how people can truly be helped. Because Lee, you have a charitable fund yourself with the coronavirus problem. What has that done to your charitable fund?
Well, my charitable funds come in when patients come in, so they're giving me $50 or more for an examination. So if there's no examinations, there's no funds.
That's right. That's the point we're going to make, and people have got to understand that there are these people out there in our community, our fellow citizens and seniors, that they're afraid to go out. They've been told not to go out, so they're in their homes. And I think it's bothered me is that we went to the base at Patrick Base at Air Force Base at the commissary store, and they actually were empty shelves in there, folks. And I've never seen that in the 30 years I've been here. In fact, I grew up in World War II, and I can remember going to the stores and the shelves were not bare, and we were fighting a war. It's almost like people are taking this coronavirus thing and making it a war. And what they need to do is follow some simple rules that our president has asked us to do, and he's passed that down to the state governors. Kerry, what do you think about all this?
Well, it's definitely an uncharted time. I've heard people make different comparisons, but this is something that is clearly new territory for all of us. I mean, you know, in the olden days, we would watch movies about such things like this, but who would have imagined even 2 months ago that here we are living through it? But one of the things that I do like is the fact that as we do the things that we're asked to do, the sacrifices about social distancing and being safe, it appears while we're here on the radio that it seems to be moving in the right direction, especially compared to some of the things that they were originally talking about that they feared might happen. I remember, Joe, and I know you do too, because our offices are in the Senior Resource Center of Brevard, which is co-located at Zon Beachside, which is one of the state-of-the-art assisted living memory care facilities here in Brevard County. And I remember very, very early on, they came and said, listen, guys, we're going to restrict access you guys are fine in your office for now, but we're going to restrict access into the Zahn facility because we want to be sure that the patients and the residents there are safe and doing all these right things. And I remember thinking at that time, wow, that's kind of extreme. And then a few weeks later, if you remember, they said, well, we would ask you guys not even to hold your advocacy meeting here right now until all this passes, even though that particular room that we use for general meetings and things that are open to the public is able to be sequestered from the rest of the Zahn facility. But they said, listen, out of an abundance of caution, we want to even ask if you guys would put those things off. And so if you think about it, we've gone kind of step by step each way to this very, very distant point where they said, now listen, we'd really like for you guys to stay home. So thank God for the miracle of technology that we're all able to be following what the governor has asked us to do and still be effective at getting information out to people through the Helping Seniors Network.
Lee? Yeah. As a doctor, you're a dentist, but you're still a doctor. You got medical training. What is from a medical viewpoint of a guy that is a doctor but is not a practicing medical doctor? What is your opinion, and what do you think have we done right, or could we have done better with what's happening now or not?
I'm really concerned, and listen, I've gone both ways on this thing, but now that stats are in, and listen, whenever you make a prediction, you make a more dire prediction, and that's the model that people bought into. And now that we've added more and more data to that model, we find out the model wasn't nearly as threatening as we thought it was. Well, and people will say, well, it's because we practice social distancing. And I suppose to some degree that's true. But I am concerned. I am concerned about the economic side of this. I am concerned about the fact that businesses are going out of business and may never come back. And that we've tried to treat the entire country as one single item when in fact there are only a certain number of pockets of problems. And so Brevard County is not a problem. If we didn't know coronavirus, we wouldn't look at the almost 100 people that have been diagnosed with coronavirus and no deaths. We wouldn't have paid any attention to this at all. And so it does concern me that this becomes a universal problem, which may not be a problem, that you introduce fear factors into a situation where fear factors may not apply to every geographic area, and that we treat this as a universal almost calamity when in fact it may not be as universal as is being painted. I'm concerned for the future. I'm concerned that people are doing something in this fashion with all good intentions, and that in fact the long-term results may be something that may be far worse than death simply due to the coronavirus. So yeah, it does bother me. From a dental perspective, we're going to be the last ones that go back into business. It isn't just going to be, all right, the coronavirus is past, go back and do what you were doing. When we go back, it's going to be, what equipment do we have to buy? What personal protective equipment do we need to do? What pre-screening do we need to do with all of the precautions and the universal precautions that we all take? And universal precautions is a standard name of what we do in order to be able to help prevent patient transfer. I'm very concerned about the additional requirements that will be placed upon dentists in order to be able to purport, and I mean purport, not to be, but to purport to be a safer dental practice. So I'm very, very much concerned about overreaction, not just now, but in the aftermath of this entire thing.
Yeah, we're considering the future, and if a problem pops up, and if I don't know why everybody thinks that the president is the guy that's responsible for this, because he's not. We make some stupid mistakes, and just like if you're right, and when you're talking about the disease being in certain parts of the country, and you look and see where those they're in areas of high density of population, and people that don't want to do things that are smart. And I was listening to the governor of New York, and while they have all those problems in New York, there were still young, young to middle-aged people still going to Central Park and gathering in large crowds. And that was not a smart thing to do. You know, people that are in areas that are affected greatly by something that has affected the general population should be very smart in how they react, because we can look at what happened in the stock market. We lost roughly 9,000 points in the stock market over a week period, and that's, you know, for people that are senior that did do a good job of planning, and there are thousands and thousands of those people that did it. They watched the wealth that they had put aside for their aging years disappear overnight. You know, when your principal and your money and principal goes to heck in the handbag, you can't afford. If you start drawing on the principal, you don't have any way to generate funds when everything comes back. And that's what you were talking about, Lee, that we all need to be concerned about our small businesses that are out there for all kinds of things. And if they don't have big reserves set up to take care of stuff like this. And here the government's put $2.2 trillion into this. And if that money gets to the right people and used wisely, it might help us. And now we're trying to get one of the small business loans, because many nonprofits in Brevard County already have been hurt to the point they're not going to come back. Nonprofits depend on a steady influx of funds for 4 or 5 things they might do to generate money for themselves all year long to serve people. And then the community thinks that these nonprofit things are just a nonprofit, and yeah, they're going to be there to help us. That's not true. And I think one of the things, Kerry, that is important for us, and you talked about it in your update, is that our education specialist, she was very smart in that she had the gumption to go out and find out all these food pantries and everything. She made a website out of these food pantries, and not only just for people, but for animals like cats and dogs, because they have to eat too. So I think that was a good thing she did.
I think so too, Joe. And that was one of the points that I'm glad you brought up, because we're in the cycle where they did come back and say, listen, it's probably best if we close the Senior Resource Center to walk-in traffic, just out of this whole abundance of caution thing. And we look forward to the day that we can kind of get back to work with all that. But at the same time, we are absolutely open for business. And Kim is taking those calls even while we're on the radio right now on our Senior Information Helpline, which I'm going to give you that number now. It's 321-473-7770. So it's 321-473-7770. And, you know, Joe, that's what she had said. She was getting an influx of calls from people who were trying to find groceries and things like that, and just reacting to that. And so that's why she said, listen, we need to put this kind of a resource together. So we have it available on Helping Seniors Updates, helpingseniors.updates.com. Okay.
Yeah, we're getting close to taking a mid-show break, and I think that Lee, I want to think about while we take our break. Think about some of the things that you hear Kerry and me talk about this stuff, and we've talked about it for years. But you've got ideas yourself, and I would really like to get more of an opinion from you as a doctor and as a citizen, as to what you think we might be able to do better, how we can protect people. And with that thought, we're going to take our mid-show break, folks.
And now here's more of our show with Joe Steckler, Helping Seniors of Brevard. Hi, Joe.
Hi, John. I'm glad to be back on the second half of the show because I was sitting there thinking about what we talked about on the first half. And right now, folks, it's just to give you an idea of what we're doing. Dr. Sheldon is over in West Melbourne on Sarno Boulevard. I'm over on the beach side. John's in Titusville, and Kerry's in Palm Bay. And here we are doing a radio show, and it's partly on Skype visual and partly on Skype just Skype voice. And it just shows what the technology has enabled us to do over the years. And I was thinking about the coronavirus thing, and there was a commercial last night, or somebody sent me one that was made in Israel, and it showed the effects of a person that was going to go into a building, and they sneezed all over the handle of the door. And they came back later to show what could have done if the person had just sneezed into a handkerchief or possibly his elbow of his arm, and that had not been, those germs had not been placed on the handle of that door, because the person, after him, a woman came in, touched the door. She had the virus on her hand. She goes into the elevator. She pushes the elevator button to go up, and she gets off on her floor, and then another woman pushes the button to go to another floor, and the virus is on her hand. But the point is, folks, we enable ourselves to spread things when we could do a better job if we just think about it. And I'm just as guilty as that as anybody. But I keep thinking about Dr. Sheldon, a man that has traveled all over the world and has been on radio and TV, because I first did, one of my first television shows I did was on Dr. Sheldon's television show years ago. And Kerry is a TV guy and a radio man, and there are things that we've all seen in our lifetime that are really good information for people to know, and we can think of things that we can tell our listeners how they could do a better job of living their everyday lives. And I think, Dr. Sheldon, that you would have some very good pointers for people who are listening about things they should or should not do. Could you talk about that just a little bit?
Yeah, sure. The first thing that comes to mind is how many times do we go to the men's room and we see people that don't wash their hands or don't flush the toilet? I hope that's going to get better as a result of this. I think if there was a silver lining, that would be it. I don't know about you, but when I was growing up, I didn't hug people nearly as much as I'm expected to hug people now, up until this time. But, there has been more social contact, hugging people you don't know, all sorts of stuff that's going on that has resulted in more social contact than maybe is appropriate. Now, maybe I'm sounding a bit on the prudish side or maybe on the conservative side, but maybe we can back off that a little bit. I think if we all learn that washing hands is as important as we've always been taught, and for anybody who's taken a cruise, they emphasize washing hands all the time. They have a little jingle. They have people playing guitars in the food line saying "wash your hands." I mean, if washing hands becomes a more than just a lick and a promise, I think that's going to be good. I think the other things I'm looking at right now are, frankly, retooling. This is a reset button. It's a reset button for all of us, whether we're retired, whether we're working, whether whatever position in life we're in. And it may be that the things that were on automatic, or for me, the automatic things that build into other automatic things, I think, there's a break that we can take and we can reassess every decision we've made with regard to the types of vacations that we take, with regard to the people that we decide that we want to associate with and maybe don't want to associate with. All of that, I think, can we can look at that and really reassess. I know that I've connected or reconnected with more people during this time than I did before. And maybe it was because I was too busy doing the automatic stuff. And maybe the automatic stuff wasn't quite as important as the reconnections that I've made. So there's going to be a silver lining here, and we're not going to be totally the same when we come out of this. There's no way on earth we could be. And hopefully, the better things, or the things that we should be doing for each other as well as doing things for ourselves, that may come to the fore. Maybe we'll cook a few more home cooked meals. Maybe we just won't be as rushed to do everything all the time, every day, go to bed exhausted. Maybe there will be some good things that will come out of this. I think there will be.
I think that there will be some good things that come out too, because I will honestly admit, in my own lifetime, I have watched people work at preparing food and then go to the bathroom and I knew for a fact that there were no towels in that half bathroom. So how do people dry their hands and come back to work? It bothers me, and we do a lot. Our workforce, many men are placed in a position where there's just simply no way to wash your hands, and you do touch your face but I think with anything, this is going to make us more aware, and people will try to do things a little bit better. Kerry, you're a radio guy, and you hear Dr. Sheldon and I talk about some of this stuff, but what is your take on having been involved with a nonprofit for many years now, and how we try to educate people? We talk about the information part of it all the time. We never really talk about the education part.
Well, we're in a time that, as to comment on what Dr. Sheldon had said, which is, I think, so true. I think if the things that are good that are going to come out of this, we have got a whole new appreciation for being, taking precautions in a way that we never thought about before. I think this is going to help us next time we have just a general flu season, because we are going to start taking seriously about washing our hands and doing all those kind of things. And, they always say it takes a couple of weeks if you're going to get into a new habit. It takes a couple of weeks of doing something to be able to get there. And so to kind of circle back and try to answer the question that you asked about, which is really what happens with the education aspect. That's, I think, the most valuable thing that we as a small nonprofit organization do here in Brevard County. We always say we have a county that's 25% over the age of 65 and 50% over the age of 50. So if you want to use the AARP definition, half of our population is seniors. Why is this moment actually a good moment for seniors? And I'll tell you why I believe that is, number one, for the first time, we're actually concerned about our senior citizens. There's been nothing but nonstop news coverage talking about we got to look after our seniors. If you're a younger person, be careful. Don't track this in. Don't give your grandmother the COVID-19 virus. Let's do all these things the safe way. And I think the other thing it's doing, and I believe that we're going to see this as we come out the other side, is people are going to be more aware that seniors need our help. Instead of just saying, they can take care of themselves. We've railed for years, and that's why we've established the advocacy program here in Brevard County. Is half of advocacy is making decision makers aware of the fact that seniors have needs. And I think there is going to be a good opportunity for us in the latter half of 2020 to let people know and to really continue to beat the drum that, folks, when we have that many seniors here in Brevard County getting, if you want to use the 50-plus number, close to 300,000 of them in Brevard County, we have got to start taking the needs of seniors seriously. And that's the part that we try so hard, is helping seniors to create education, both when people call Kim and they ask her questions directly, or when you do radio programs, TV programs, you write the columns in Hometown News. All of those things the Senior Scene magazine effort. Everything that we do is geared to getting information in the hands of people that is going to help them make the most of their senior years.
Well, it is like Dr. Sheldon has a specialty practice with the implant, but his son does general dentistry there, and a lot of people may not understand that. But having said that, let's say there is a 91-year-old man that lives someplace in Brevard, and he wants to get to Dr. Sheldon's office. Cabs are so they're hard to find, and they're extremely expensive. And seniors, a lot of them have certain types of insurance that works for them, that helps them get a doctor's service or a dentist service. But they got to get to that place. They have to get to Dr. Sheldon's son in order to be treated. But they give up because they don't know who to call. And I had a person call me at sort of the height of this coronavirus thing here, and they said they called a certain organization here that receives federal money, and they couldn't get them to talk to them. I wanted to talk to them about transportation. And I said, they're not closed, they're there. And I made a phone call, got through right away. You got to be patient. In times of a problem in the country, you might need dental treatment, you might need medical treatment, you might need a number of things, but some needs might be a little bit more important than what you need, and the assets that are available to take care of and help people, I guess, stretch pretty far and thin in crisis situations. So
it may be, Joe, but I'll tell you, for seniors, we have picked patients up at their homes and driven them back. I mean, it doesn't happen very often, but if they say I can't get here, we get them here. Any dental office, I think, is, well, maybe not anyone, but many dental offices are willing to, even in good times, and this is probably not going to be the best time coming out of this, but I think people are willing to do what needs to be done in order to be able to help their patients, help their customers. And you'll probably see more of that now that we've gone through this, and now that we're in such a mood to help each other. I think you'll see more of that.
Okay, you say if somebody needs help, you can get them to your offices.
Oh yeah.
But Lee, do you really think that general? Okay, you watched me limp around on my two gimpy knees for a number of years. I've gone through all kinds of pain treatment. Doggone things work, and I finally had an appointment that I had waited for 3 months for a surgeon to look at me, but they called and said because of the coronavirus, they delayed it 3 more months.
Yeah.
That's for people that are in pain and people need help. It's hard. It's hard to have doctors move all this stuff back. I guess doctors have the same right as everybody else to refuse to treat people or to practice the social distancing thing themselves. But if this goes on into the future, there are going to be a lot of people hurting that can't get treated the right way. And you as a dentist have to use your hands to treat somebody. You have to.
I do. And also, we're spraying water and spraying air in the mouth, and anything that sprays in can come out. And so there are certain concerns that we all have. I'm not sure why the doctor canceled your appointment. We've been told not to do elective care, and elective care means bleeding, pain, or infection in the mouth. I don't know what they're talking about as far as elective care for you. It seems to me that you're in pain, that's not elective. But I've seen people have, I know one person who had her endoscopy, who was supposed to have an endoscopy, that was canceled. There are a number of appointments that people are making now that are being done by telephone or by video, by Zoom, or by a platform that allows for a HIPAA-compliant way of talking with the doctor without seeing the doctor. So those changes are occurring. I think those changes are going to be permanent. I don't think we're going to have to go to the doctor and actually visit the doctor's office every single time, particularly for a consultation. If you don't need to be there, we won't be there. So those changes are going to occur. I don't understand why your pain thing was canceled, but perhaps we all got the rules. We all were all told what we needed to do and what we could do and we couldn't do. Perhaps that's what if it was the orthopedic or the neurological side. Perhaps that's what they were told. I have no idea what happened to you. That doesn't make a lot of sense.
Well, I think what a lot of it is if you're seeing a doctor that you've been seeing for years, and a doctor knows that you're an honest person, and if you say you're hurting, they believe you. But I've never seen this doctor before, and he's never seen me, so I understand.
Well, I'm even seeing patients that I haven't seen before. I mean, there are only a certain number of surgeons in this county, oral surgeons or periodontists, and so if a patient has a problem, I can't say no. If a patient has pain, the patient's coming in to see us. I mean, that's just the way it is.
Yeah, but when you became a dentist, you're just like a doctor, you took an oath to help people, and
right.
Sometimes I think it's just a hard situation because we see part of our community sort of walking away from things, and the other part of the community just having to serve. And I know nurses and doctors, when they just shipped 1,100 nurses and doctors from one part of our country up to New York. This is serious. I've got a granddaughter that's been in the ICU part of the hospital, and they moved her to another part. Now they're taking all the nurses and moving them into where they're treating the people with the virus, and they don't have a choice. They do what they have to do. They can take as best precautions as they can, and I understand that. And I think, and it's exactly what you said, Kerry, and Lee has hit at it. We're seeing things change in our lifetimes, and we're going to see more change. Some of it we're going to like, some of it we're not going to like. But I think that's what this coronavirus thing is sort of teaching all of us, is that we can do without certain things, but it's hard just to stay in your house and be concerned about going to the store to buy an address book or something like that. And all the times we stay away from these stores, we're killing the businesses or biting the hand that feeds us, because we get unemployment down, and then we turn around and we got 6 million people unemployed. So it's a problem. It's a real problem.
Well, we've got to come out of this. And, yes, I have an entire staff of unemployed people. 19 people are unemployed. You can't. So yes, it's small business, and you can't function that way forever. And that's circles back to what I said. And people have been arguing it, but they have not. Right now, it's not taking the most prominent position that it should, but it will. Right now people are saying health, disease, coronavirus. Ultimately, they're going to say, hey, I've got to make a living. I got to pay my bills. And that, if I can't do that, that's going to make a big difference. I'm just wondering how long we can really carry on with this before that situation is irreversible for some people.
Kerry, you travel all over, and you're involved both on the just the everyday on the job training side of this, but you're also involved in the ministry part of it, and traveling around helping churches do their video work and everything else. What do you see about, or what do you think about what Dr. Sheldon and I are talking about?
Well, I think it's a unique time in history that none of us in our lifetime that I'm aware of has we've been through. I mean, I'm reading the historical accounts just like you guys are, of this Spanish flu thing that came out, in the second decade of the 1900s. And so I guess this is something we're learning a lot about as we go along. But I'll tell you what I am encouraged about, and that is because coming from the, if you will, the church side and all of that, one of the things that has always been important to those of us who have faith is that we do believe that there is a plan, and there is a thing that is happening that goes beyond random chance. And one of the things that I'm really encouraged to see at this moment is that people are understanding that their lives amounts to more than the quest for the next roll of toilet paper, if you will, that there are some things that questions that we should be addressing. And one of the things that while everybody is locked in their homes and they're going to be going to church services or houses of faith at this time during this season where we can't really go and gather the way we've been used to, we're using the technology to do it. But I think the technology has been provided for us at this time. And what I think is something that Dr. Sheldon pointed out a minute ago too, is that the shifts that are going to come from this, we were talking earlier about how people are getting used to working with Zoom and technology like we're doing the radio show right now with Skype. And Dr. Sheldon was talking a little bit about telemedicine and things like that. I think it's the next wave. And I really, being the eternal optimist, believe we're going to bounce back from this faster and in a strong way that we probably can't even imagine from sitting here, because what it's causing us all to do is take stock and evaluate how are we being efficient. And the American people are the most brilliant people about being innovative and finding a way to fight a problem. I mean, everything I can see about our history as a country is we have always figured our way out of stuff. And that's what I see. And that's what I love to see, the spirit of what's happening here in Brevard County. When I look at what's going on, as we talk about the updates, and I talk to people who are in charge of assisted living facilities or who are doing home health care. And, Jennifer Helen, who sits on our board with Helping Seniors, one of the things they've been doing, Helping Seniors, is making sure that they get, as funny as it sounds, they're taking the time to make sure seniors have toilet paper and other essentials that they may need at home. And so I just see everybody rising to the occasion. And I think that when we come out the other side of this, which I don't think is very far, I think if they're telling us we're at the apex of this now, and it may take a couple more weeks before they claim that we're past the apex in Florida, if we can stay safe, not panic, and I believe we're going to get back to business. It won't be business as usual, but it will be business at the next level, and that's really my hope and prayer in all of this.
Yeah. Well, Kerry and Lee, we're getting close to the end of the show, but I just want to remind everybody that the car raffle we started has just been postponed. We did not cancel the car raffle, folks. You can still buy your tickets. You can still send your money in and help support an organization that gets this kind of information out to you. Because if you don't buy tickets for the car raffle, we don't have a way to generate income. That's one of our income things. So if you can still afford to buy tickets, we would appreciate it if you do it. And as soon as they tell us that we can have the car raffle, we will schedule it and we will get it out on everything possible. We'll do it through the newspaper, we'll do it through television, we'll do it through Skype, we'll do it through radio, we'll get everything out so people will know. And but we're getting close to wrapping up the show, folks. We got about 2 minutes left, and actually 3 minutes left. And so that gives Lee and Kerry a chance to say something. Who should I trust that won't talk too long? Lee, I'll gamble on you. Can you say something intelligent for the last part of the show? I don't want to talk about you and your. Well, enough said. I'll let you do it. We're down to 2 minutes. 3.
Yeah, I think right now, if people are really concerned about protecting themselves, and people are of my age, which is 69 years old or older or younger, around that age, I think it behooves you to stay close. I think I would follow the governor's order. I would wear a mask when you go outside, particularly if you have immune compromised. If you're taking steroids and things like that, you're immune compromised. You should be wearing a mask. And you should be staying at home. Go out and get some exercise, but let somebody else get some groceries for you. I think that's going to help you, and that's going to get you past this. I think that's probably going to be the most important social distancing that we can see right now.
Lee, because you just said you were 69, is that why you always treat me like I'm your father?
Do you treat me like I'm your son?
Kerry, you want to wind it up today?
Yeah, I just want to say helpingseniors.carraffle.com. helpingseniors.carraffle.com. We're sitting in our homes. We're expecting stimulus checks. What a great thing to do is to pay it forward right now and help us in the work of helping seniors. One ticket for $25, 5 for $100. It's the most important charitable deduction you can make. And as I understand, they're creating some new laws that are going to make it possible for you to deduct that regardless of your income and some of the tax rules as part of the stimulus package. And so want to encourage you to get involved, because when this is all through, we're going to have a great big party at the American Muscle Car Museum.
I agree. And folks, I just want to thank you for listening to Dr. Sheldon and Kerry Fink and me today. We rambled a bit, I understand, but Talk to Me Radio is something we can say, and I'm going to wrap it up right now and just say thank you to everybody. Please support our car raffle, and we will let you know when it's going to be. Thank you, Dr. Sheldon.
Thank you, Tom.
Bye-bye.